All right, welcome back to the July 31st through August 1st, 2024 board meeting. My name is Sung-Oh, president of the board. Before we convene, I'd like to again remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. Also, just as announced via subscriber alert and yesterday during the meeting, the board will immediately convene in closed session now, and we are anticipating reconvening open session at 10:45. Also, in the interest of time, the board will be limiting the items its reviews and considers today when we reconvene for open session. The following items may be scheduled at subsequent meeting, but will not be discussed today. As announced yesterday, presentation on the pharmacist recovery program will be rescheduled. Discussion and consideration of the board's strategic plan will occur at another meeting. In Enforcement Committee, summary of the presentation on the board's inspection program, citation and fine program, automated drug delivery systems, and enforcement statistics are available in the meeting materials. The draft FAQs related to AB 1286 will be considered at a future meeting. In licensing, information on the summary of presentation on central fill pharmacy models, proposed amendments to pharmacy law to transition to a more robust standard of care model, and licensing statistics are included in the meeting materials and will not be discussed today. I want to highlight that the licensing committee will be scheduling another meeting to discuss the standard of care proposal. The anticipated date is September 4th. In communication and public ed, information on the transition to a new website template, update on the talk to an expert consumer poster, and communication and public education activities by staff are included in the meeting materials and will not be discussed today. The meeting materials provide updates from the Organizational Development Committee and Executive Officer. Discussion will also not occur for these agenda items. And Legislation and Regulation Committee report will only include discussion and consideration of AB 3063 and SB 1089. Please refer to the meeting materials for other items on the agenda. As I facilitate this meeting, I will announce when we are accepting public comment. I've advised the meeting moderator to allow 3 minutes to each individual providing comments. We'll begin with public comments for individuals attending in person, followed by public comments by individuals participating via WebEx. This approach is necessary to facilitate this meeting. Before we get started, I would like to ask staff moderating the meeting to provide general instructions.
Good morning. When it comes to public comment, we will give you 3 minutes to speak, and I'll give you a 10-second warning before your time expires. Also, when it comes time for public comment, we're going to ask everyone to raise their hand to queue up for public comment. You can do that by tapping the hand button at the bottom of your screen. Dial-in users will need to dial *3 to raise a hand. And for our mobile device users, you have 3 different screens and only one of them has a hand button. So you may need to hit the ellipses button, that's the ... and cycle through the 3 screens in order to find your hand. President O.
Thank you, David. All right, I would like to take a roll call to establish a quorum. Jesse Crowley. Jesse's not here. Trevor Chandler. Trevor is not here. Renee Barker. Renee is not here. Indira Cameron Banks. Indira is not here. Jeff Hughes.
I'm here.
Thank you, Jeff. KK Jai.
Licensee member present, sir.
Morning, KK. Jay Newell.
Public member present.
Good morning, Jay. Satinder Sandhu.
Present.
Thank you. Maria Serpa.
Licensee member present.
Thank you, Maria. Nicole Tebow.
Licensee member present.
Thank you, Nicole. Jason Wise is not here, and I am here. Nicole?
Yes. Do I make both statements at once? Do you know?
Yes, it's fine to make both at once.
Sure. So I need to participate remotely as I have a chronic illness and am not medically permitted to travel. And there is no one in the room with me over 18 years of age.
Thank you, Nicole. A quorum has been established. I note that today member Tebow, who is attending and participating remotely, counts toward quorum as permitted by Government Code Section 111323.2J. Member Tebow, for the record, thank you for providing your in general description of circumstances. And Board Member Tebow's description of the circumstances relating to her need to participate remotely at today's meeting. The board must take action as required by Government Code Section 11123.2. J, as such, at this time, I would entertain a motion to approve Member Tebow's attendance and participation from a remote location at today's meeting, and authorize that her attendance and participation from a remote location shall count toward the establishment of a quorum as permitted in Section 11123.2J of the Government Code. I will make a motion.
I'll second that.
Thank you, Maria. With a motion and second, we're ready for public comment. No public comment in Sacramento. We're ready for public comment in WebEx.
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand. We will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. For those who have keyboard-only access, you may also type the word comment into the Q&A box in the lower right-hand corner of the screen and send that comment to all participants. Seeing no request for public comment, do you wish to continue with the motion?
Yes, please. Thank you. Ready for a vote? Jeff?
Yes.
Thank you, Jeff. KK?
Yes.
Thank you, Jay.
Yes.
Thank you, Satinder.
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. Motion passes. As announced yesterday and via subscriber alert this morning, we will now convene in closed session and return at 10:45. We are ready to get started on the open session. Welcome back, everyone. As announced earlier, in the interest of time, the board will be limiting the items it reviews and considers today when we reconvene for open session. As announced earlier, I will repeat, the following items may be scheduled at subsequent meeting but will not be discussed today. Presentation of the pharmacist recovery program will be rescheduled. Discussion and consideration of the board's strategic plan will occur at another meeting, an enforcement meeting. Committee summary and of the presentations on the board's inspection program, citation and fine program, and automated drug delivery systems, and enforcement statistics are available in the meeting materials. The draft FAQs related to AB 1286 will be considered at a future meeting. In licensing, information on the summary of presentation on central fill pharmacy models, proposed amendments to pharmacy law to transition to a more robust standards of care model, and licensing statistics are included in the meeting materials and will not be discussed today. I want to highlight that the licensing committee will be scheduling another meeting to discuss the standard of care proposal. The anticipated date for this meeting is September 4th. In communication and public ad, information on the transition to a new website template, update on the talk to an expert consumer poster, and communication and public education activities by staff are included in the meeting materials and will not be discussed today. The meeting materials provide updates from the Organizational Development Committee and Executive Officer. Discussion will also not occur for these agenda items. Informations are provided in the meeting materials. The Legislation and Regulation Committee report will only include the discussion and consideration of AB 3063 and SB 1089. Please refer to the meeting materials for other items included on the agenda. I truly appreciate everyone's time and commitment to the Board on California consumers. I ask everyone participating today to be respectful of the work before the board today. We encourage participation by members of the public throughout our meetings at appropriate times. The board respectfully requests that when comments are provided, they're done so in a professional manner consistent with how the board conducts its business. All right, and need to take a quick roll call to establish a quorum again. Jeff Hughes,
Public member present.
KK Jha,
Licensee member present.
Jay Newell,
Public member present.
Satinder Sandhu.
Licensee member present.
Thank you, Maria Serpa.
Licensee member present.
Thank you, Nicole Tebow.
Licensee member present.
And I am here. A quorum has been established. And before we move to the next agenda item, I'd like to also remind board member Well, it's just Nicole today participating via WebEx to please remain visible on camera throughout the open portion of today's meeting. If you need to temporarily turn off your camera due to challenges with internet connectivity, please remember to announce the reason for your non-appearance when you turn off your camera. Next, agenda item 5, discussion and possible action related to proposed amendment to California Code of Regulation Title 16, Section 1709.1 related to designation of pharmacists in charge, including review of comments received during the 15-day comment period. Members, the next item for our consideration is the board's proposed changes to California Code of Regulation Title 16, Section 1709.1 related to pharmacists in charge requirements. As a reminder, in January of 2022, the board approved proposed regulation text to amend Section 1709.1. The formal rulemaking process did not begin until November 2023, with a 45-day public comment period ending January 1st of 2024. You may recall that during the February board meeting, we considered comments received and voted to amend the text in response to comments received. The subsequent 15-day comment period ended May 14th, 2024. Today, we have the opportunity to review the comments received. I trust members had an opportunity to review the comments received and the staff recommended responses. I have reviewed the material and agree with the staff recommended response. I note that meeting materials and meeting slide have proposed motion language that could be used to adopt the regulation text. As I open for member discussion, I would also entertain a motion if you believe such action is appropriate. Members?
I'll make the motion, accept the staff recommended comment response and adopt the regulation text as noticed on April 29th, 2024. Additionally, delegate to the executive officer the authority to make non-substantive changes as may be required by the control agencies to complete the rulemaking file.
Thank you, Maria. Second?
Second.
Thank you, Jay. Appreciate that. All right. We're ready for public comment in person. Seeing none, ready for public comment WebEx.
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand. And for our mobile device users, you may need to hit the ellipses button, that's the ... and cycle through one of 3 different pages in order to find your hand button. For those of you who have a keyboard and no mouse, you may type the word comment into the Q&A box in the lower right-hand corner of the screen and send that comment to all participants. We're going to take just a few moments to see if we have a request for comment on the motion before us. Seeing no request, do you wish to continue with the motion?
Yes, please. Thank you. Ready for vote. Jeff, how do you vote?
Yes.
Thank you, KK.
Yes.
Thank you, Jay.
Yes.
Thank you, Satinder.
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes, the motion passes. Next, agenda item 6, approval of board meeting minutes. Members, included in the meeting materials are draft minutes from several meetings, beginning with the April 24th through 25th, 2024 board meeting. Members, I welcome your comments and also entertain a motion to approve the minutes for April 24th through 25th, 2024 board meeting. Members?
I move to approve the April 24th, 25th, 2024 board meeting minutes as presented in the meeting materials.
Thank you, Maria. Any second?
I'll second.
Thank you, Satinder. Ready for public comment in Sacramento? Ready for public comment in WebEx, David?
We are once again open for public comment. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request, do you wish to continue with the motion?
Yes, please. With a motion, a second, and public comment, we're ready for vote. Jeff, how do you vote?
Yes.
You, KK?
Yes.
Thank you, Jay.
Yes.
Thank you, Satinder.
Yes.
Maria?
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes, the motion passes. Next is for March 13th, 2024 Disciplinary Petition Committee meeting. It's like the shortest minutes ever. Ready for a motion, members?
This is Nicole. I motion to approve the March 13th, 2024 Disciplinary Petition Committee meeting minutes as presented in the meeting materials.
Thank you, Nicole. And do we have second?
I'll second.
Thank you, Satinder. Motion and second. Ready for public comment in Sacramento? Ready for public comment in WebEx? David?
We are open for public comment on agenda item 4B as in Bravo. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request, you wish to continue with the motion?
Yes, please. Thank you, David. With the motion and second and public comment, ready for vote. Jeff, how do you vote?
Yes.
Thank you, Jeff. KK?
Yes.
Thank you, Jay.
Yes.
Thank you, Satinder.
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. Motion passes. Last minute is for May 8th, 2024 Disciplinary Petition Committee meeting. Members, any comments or anyone wants to make a motion to approve the minutes?
I'll move to approve the May 8th, 2024 Disciplinary Petition Committee meeting minutes as presented in the meeting materials.
Thank you, Maria. Do we have second?
I'll second.
Thank you, Satinder. I appreciate that. Ready for public comment in Sacramento? Ready for public comment in WebEx?
We are open for public comment on the next part of 4B. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of your screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing the request, you wish to continue with the motion?
Thank you. Ready for vote. Jeff?
Yes.
Thank you, KK.
Yes.
Thank you, Jay. Satinder,
Yes.
Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. All right, next agenda item is agenda item 7, which was the report by the Department of Consumer Affairs. I believe Ms. Bucarelli will submit the written report to members and will be posted. So we're moving on to next agenda item, which was agenda item 8. Also is, we're not gonna have a presentation on the pharmacist recovery, so we're moving on to the next agenda item, which was agenda item 9, but we're also moving forward. And agenda item 9 will be discussed for future, in the future meeting. So next is we're moving to agenda item 12, Enforcement and Compounding Committee. I will now turn the meeting over to Maria Serpa, Chairperson of the Enforcement and Compounding Committee, to provide a report on the committee's effort. And again, Maria, floor is yours.
Thank you, President O. On behalf of the committee, I'm pleased to provide the board with a summary of the committee's efforts at our July 17th, 2024 meeting. Thank you to my fellow members, Vice Chair Renee Barker, Indira Cameron Banks, Sung Oh, and Nicole Tebow. As a reminder, meeting materials contain the following items that were on the agenda, but we will not be discussing them today. They're in the meeting materials. Presentation of the board's inspection program, presentation of the board's citation program, presentation on quality assurance reports received pursuant to California Code of Regulations Title 16, Section 1711F, related to use of automated drug delivery systems. The next item that we will discuss will be discussion on policy statement related to IV hydration clinics. Let everybody get to that page. Members, the meeting materials include relevant sections of federal law that establish conditions under which compounded human drug products are exempt from 3 sections of Federal Food, Drug, and Cosmetic Act. The meeting materials also provide some background information on the issue of IV hydration clinics, including information about warnings released by the FDA involving instances of drug products being compounded under insanitary conditions. The materials highlight many warnings stemmed from the compounding occurring at sites that are not regulated by the board, including IV hydration clinics. As we discussed during the April board meeting, IV hydration clinics appear to be operating in a number of settings, including beauty salons, mobile vans, gymnasiums, and appear to lack appropriate oversight, use of appropriate equipment, and proper storage, placing patients at risk. We also see examples in this practice in the media and advertising offering IV hydration in the workplace, in the home, or in hotels. These issues are occurring across the nation, including California. Board staff have observed inspections in some IV hydration clinics and report witnessing alarming practices that place consumers at risk. Staff also report challenges in conducting investigations because even basic patient information, administration information, etc., is not maintained or provided to the board. Given the risk to patients and the documented harm, this issue was brought before the committee to consider issue and determine if there are any actions the board should take to protect patients. Following prior discussion by the committee and the board, it was determined appropriate that the board should have a greater role in the monitoring of this practice and should start with the development of a policy statement to educate consumers about IV hydration clinics and some of the potential risks, without creating undue concern for patients who have a medical condition that require such treatment. Members, attachment 4 to the meeting materials includes a draft policy statement that include changes that were made following the committee meeting to incorporate the changes requested. The policy statement is being reviewed by other California healthcare boards in hopes of including a list of healthcare boards and their contact information at the end of the policy statement. As included in the meeting materials, the committee is recommending approval of this policy. The committee's recommendation serves as a motion. So the motion is already presented by the committee. Members, do you have any questions or comments about the draft policy? Okay.
Other than to say I support. That's it.
Thank you. We'll move on to public comment. Is there any public comment in Sacramento? Seeing none, we're ready for public comment via WebEx.
We are open for public comment on agenda item 9. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of your screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing no request, you wish to continue with the agenda?
Thank you. Since there are no additional comments, I turn the meeting over to President O for the vote.
Thank you, Chair Serpa. Jeff Hughes?
We have a motion.
Committee motion.
Yes.
Thank you, Jeff. KK Jha?
Yes.
Thank you, Jay Newell.
Yes.
Thank you, Sachinder Sandhu.
Yes.
Thank you, Maria Serpa.
Yes.
Thank you, Nicole Tebow.
Yes.
Thank you, and I vote yes, the motion passes. Back to you.
Thank you. The next 2 items are in the meeting materials and will not be presented. That's discussion and consideration of updates to, that will be considered at a future meeting. So the updates to FAQs regarding Assembly Bill 1286 will be considered at a future meeting. What isn't part of your meeting materials and will not be considered, will not be presented, but is the enforcement statistics. President O, that concludes my report for the Enforcement and Compounding Committee. I bring the meeting back to you.
Thank you, Chair Serpa, as always. All right, next agenda item is 13, Licensing Committee. I'm pleased to provide a report on the Licensing Committee. Thank you to my fellow committee members, Trevor Chandler, Renee Barker, Jesse Crowley, Satinder Sindhu, and Jason Wise. We had a very long and very productive meeting again on July 18th. Unfortunately, most of them are not here today, but hopefully that the committee's recommendations and the documents are clear and provides adequate information for us to consider all those items. First is proposed amendment. Again, as announced, the summary of presentation on central fill pharmacy models and licensing statistics will not be discussed today. And we're going to get right on to the proposed amendment to business and professions code sections related to the definition of pharmacy technician trainee. As you may recall, during the past meetings, the committee has received presentations on and discussed pharmacy technician training programs, including employer-based training programs. Members have noted that what appears to be a great variability in the quality of employer-based programs and suggested perhaps the need for greater oversight of such training programs. As noted in the meeting materials, as part of those discussions, we note that the current definition of pharmacy technician trainee is currently limited to a person enrolled in a pharmacy technician training program operated by a California public post-secondary education institution or by a private post-secondary vocational institution. As currently defined in the law, this definition does not extend to an individual completing an employer-based training program. As I shared during the committee meeting, it is important to note that while we are expanding the definition to encompass the additional training programs, the provisions for a training program will remain consistent, including requirements that a training program cover all knowledge and understanding of different pharmacy practice settings and laws and regulations governing the practice of pharmacy. I'm highlighting this to ensure there is a clear understanding that an employer-based training program cannot be solely focused on the specific pharmacy or type of pharmacy. This is in large part because once technician licenses are issued, the license allows the pharmacy technicians to work in a variety of settings, not just the pharmacy where they completed the employer-based training. I'd also like to remind everyone that the provisions related to externship requirements for a pharmacy technician trainee will apply irrespective of the individual's pathway to functioning as a pharmacy technician trainee. As I did during the committee meeting, I'm again highlighting this to ensure everyone has a clear understanding of the hours and hours limitations established in existing law and the applicability of those provisions. Members, Attachment 1 to the meeting materials include a copy of draft statutory language reflecting the committee's recommendation. Please note that the committee is offering a recommendation which will serve as our motion. Corinne, did you have anything to say on this item? Are we clear to proceed?
I think my comment had to do with that the motion is limited to amending 4038B, but the attachment includes conforming changes to Business and Professions Code 4115.5 as well. So for completeness, I think the motion should encompass that.
So you're actually recommending that we vote down this motion, the committee motion, and make a new motion incorporating your comments?
Yes.
Okay. Members, any comments related to both the technical aspect of the motion, which is expanding the definition, as well as any comments or questions? Okay. Go ahead, Maria.
So before we open up to public comment, your suggestion is to vote down this motion so that we can have another motion. Thank you.
Okay, we're ready for public comment in Sacramento. We have one coming.
Thank you, Mark Johnston with CVS Health. I noticed that the word accredited was included in here. When I read the word accredited, I think of only one accrediting agency, and that's ASHP. I'm not sure that the board intended to mandate ASHP accreditation for these programs. The Utah Board of Pharmacy is in the process of promulgating a rule to remove their ASHP accreditation because they found it to be a barrier to entry to technicians, creating a shortage in their state. Louisiana is removing their ASHP accreditation. Their proposed comment period is right now. That would only leave Virginia and North Dakota as the two states that would require this. So I ask you to reconsider the word accredited. When I think of recognized, I think of PTCB, which is again another entity that reviews training programs, and they issue a recognition. I'm going to guess that the majority of the pharmacies in the state are certainly not accredited, probably not recognized, and I believe this adjective is should warrant your reconsideration. I'd also like to ask if the 1-to-1 ratio for externships includes truly just to the hands-on portion, or in pharmacies where in the licensed space you have a training lab where there may be many computers and a couple of trainees who are doing the module portion of training. Would they be included in the 1-to-1 trainee ratio? This was really only intended for the hands-on portion of training, and this would drastically hurt the facilities that are designed to be training, basically have, education portions of their pharmacy in an adjacent office, if you will. Lastly, CVS's program fits very squarely into the 120 to 140 hour limit. That would mean that the module and classroom training is between 100 and 120 hours. So right now, we don't actually have a problem with this, but it's pretty limiting. And I'm not sure the board's intention was to say that your classroom has to be between 120 by limiting. It's pretty restricting. It's okay with us, but I feel like I'm speaking for other pharmacies on that point as long as I'm up here. Thank you for your consideration.
Thank you for the comments, Mark. Seeing no other public comment in Sacramento, we're ready for public comment in WebEx. David?
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. As a reminder for our mobile device users, if you're having trouble finding that hand button, please tap the ellipses button, that's the ... in order to find your hand. And it looks like our first request comes from Jaya George. Hold on just a moment. We're sending you a request to unmute your microphone. You'll be given 3 minutes to speak, and I'll give you a 10-second warning before your time expires.
Hello, my name is Jaya George, and I am a faculty director for a community college with the pharmacy technician program. My question is, how does the Board of Pharmacy keep track of all of the programs that are training? Is there a place where we submit our curriculum to? How does it acknowledge the programs? For example, organizations such as PTCB require us to send in our curriculum. So how do we address that? If I'm starting a new program, do I just have my students submit the application? Thank you.
Thank you for the comments.
And that was our only request for public comment online.
Thank you, David. Okay, with a motion, committee's recommendation serving as a motion. Oh. David, I think there's one more in the comments. David, you're muted.
Thank you. Jassy, we're going to send you a request to unmute your microphone. Hold on just a moment. We're going to find you in the list.
Good morning, Jazzy Graywall with UFCW Western States Council. Apologies, might have been a little late typing into the Q&A, so appreciate you all coming back to me. Just wanted to make a couple comments that there was a really great discussion in the subcommittee a couple weeks ago, and really appreciate the board's language on making sure that there's some accreditation that does occur of training programs. UFCW is significantly concerned with the language that was proposed before that did not include any accreditation, because we do know that there are training programs out there, or there could be training programs out there that are predatory towards pharmacy technicians. And by making sure there's some level of accreditation, there is oversight of those training programs and the curriculum that farm techs are being trained on. We often hear from retail pharmacy technicians that are being trained that they're typically trained specifically to that employer. And when they try to seek a job at another pharmacy, it's often very difficult for them because they need to be retrained per that employer, and not necessarily are trained broadly on pharmacy technician requirements. And so we think the training around accreditation is really important to make sure that pharmacy technicians who are trained and are licensed are able to move between different types of employers and workplace settings that do allow that. So just appreciate the committee's discussion a few weeks ago and the language that's being proposed by the board. Thanks.
Thank you for the comments, Jazzy.
And this time, I believe that was our last request.
Thank you, David. Okay, with the committee motion and public comments, we are, due to some legal clarification, we are recommending that we vote down this motion. Jeff, how do you vote?
No.
Thank you, Jeff. KK?
Nope.
Thank you, Jay.
Nope.
Thank you, Satinder.
No.
Thank you, Maria.
No.
Thank you, Nicole.
No.
Thank you. And I vote yes. I mean, no. That would have been the funny one, eh? Okay. All right. So now we need to figure out correcting. Corinne, can you help us?
I mean, the board could consider a motion to recommend amendment to Business and Professions Code Section 4038B to read pharmacy technician training. Oh, okay. 4038B as presented with conforming changes to Business and Professions Code Section 4115.5 as presented.
Okay, and just for members, at the committee, we had a very robust discussion about accredited versus not just, and our original proposal was not accredited, but we just decided to take a one-step approach just to start with accredited programs first. Again, this is still opening more opportunities for farm techs to be trained at more scenarios. So just wanted to put it out there.
To add to that, I think there were some public comments regarding, I think there was also some public comments that, in the future, they like CPHA, for example, can create a program so that
Accredited.
offers more avenues, not just the ASHP.
Just for my knowledge, does the broad market has enough accredited programs for a tech to go, or does it create some kind of oligopoly?
So go ahead, Dave, go ahead.
Or is it beyond the scope of this meeting?
Yeah, so that's probably a little bit of a bigger discussion. Really, what we're focusing on here is expanding. We're not changing pathways to licensure. What we are doing is creating an opportunity for people that are in an accredited employer-based training program, which is already a pathway, right, to gain hands-on experience through the technician trainee.
I have, and I mentioned at a previous meeting, serious concerns with the accreditation process. And so the word accredited did stick out because my question was accredited by whom? Because in the past, training programs have said that they were accredited because they're accredited by the post-secondary education. What is it? Here it is. I'm sorry, I can't reach the microphone. By the private post-secondary and vocational education programs. And so that's an accrediting agency for educational programs, not necessarily healthcare, not necessarily pharmacy. So I think this is a nice attempt to broaden that so that employer-based training is also covered. But I'm concerned that it is not clear. I don't like the word registered or recognized either, because by whom, again, comes down to. And just from a personal experience, you know, at least in the Sacramento area and some of the greater Northern California area, in acute care pharmacy, we have policies that encourage the use of or the hiring of pharmacy technicians that come from the ASHP accredited program. I know that's the only accrediting agency, but it's because the preparation in some of the programs is so poor that they don't even qualify to be interviewed in some organizations. So I think if we want to have a basic minimum qualification, we need to state what that is. I'm not sure what the word needs to be, but if we do use accredited, I think it needs to say what the criteria of accreditation is or by whom, because otherwise you'll have everybody developing their own definition of what accredited means.
Good point, Maria. With that, any suggestions?
It's hard because I don't have a suggestion, because you don't want to say nationally accredited because that just limits too many things. I don't like recognized unless you say something like pharmacy recognized.
I would just throw it out there. This is like a legislation, right? So that the sausage making, I don't know.
So as long
why
as
it's
we
always sausage.
Okay,
making.
so I hear your point. So as long as we have intent and a policy that we should move ahead with the legislation, because amendments will be taken during the legislative process.
I would imagine, and I don't want this to be any delay in at least providing a hands-on training for technician trainees who are in these programs, right? Hopefully, so I want this to at least somewhat move forward in some ways, move the ball rolling. So, would you, with that, do
Oh, so then I
a motion?
guess I will make the motion, hopefully as Corinne stated. I think, is it the one on the screen, the corrected one?
Is not.
So if I can just jump in. So when it was a committee recommendation, we had to recommend approval because the committee can't make a full thing. But as this is from the board, I think it's, a vote to pursue amendment to Business and Professions Code 4038B and 4115.5 related to pharmacy technicians or pharmacy technician trainees consistent with the board's discussion. And then I think that then captures your comments about the accreditation and further refinement.
Do we need to include authorization
So-
for others, for the staff or for the EO?
So
to make
generally not when it's
legislation?
statutory.
Not for statutory. Corinne, do I have to repeat that or can we just?
I think, Debbie, did you capture it? Yeah, I think we're good.
So moved.
Thank you. Second.
I'll second.
Thank you, Satinder. Public comment in person. Morning, Mark.
Mark Johnston, CVS Health. So if I understand the motion, it's to move forward language that you know is not correct for the legislature to clean up for you. And that's what you need to want to be known as a board, as we push forward bad language and hope that you clean it up for us. I think you need to, as Maria said, talk about the word accredited a little bit more.
Thank you for the comments, Mark. Anyone in person? Seeing none, ready for WebEx? David?
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand. And our first request comes from Keith Yoshizuka. Hold on just a moment. We're sending you a request to unmute your microphone.
Much. To address Mark Johnson's concern, maybe the language should be accredited by an entity recognized by the Board of Pharmacy or approved by the Board of Pharmacy. That way you can automatically include ASHP, but it leaves open the the possibility of another accrediting body, even one that's developed subsequent to this discussion, such as CSHP or CPHA. Thank you.
Thank you for the comments. Dr. Yoshizuka.
Next, we're going to hear from Stephen Gray. Hold on just a moment. We're sending you a request to unmute your microphone.
Agree with what was just spoken by Keith. As I pointed out, a good example of this is that the scope of practice and the authorizations for pharmacy technicians in California is quite different from most of the other states. In fact, virtually all the other states, especially for those on the board who are not pharmacists. In many states, if not most of them, anybody that's not a pharmacist or a student pharmacist that is in the pharmacy is often just considered a technician. That's not true in California. And the differentiation in California for a pharmacy technician scope of assistance is specified under law, and it differentiates them from clerks, cashiers, stock clerks, and other people who are assisting the pharmacist in the pharmacy or hospital environment. And so it's perfectly reasonable, in fact, I think especially reasonable, that the board have the ability to approve some entity other than ASHP or a national organization for this purpose. And a good example of that is the California Pharmacists Association under California law is approved as an accreditor for continuing education for pharmacists and technicians. So I think what Dr. Yoshizuka said makes a lot of sense and is really very preferable. And I urge you to make that change in the wording. Thank you.
Thank you for the comments, Dr. Gray. I feel like being at home, hearing from Mark, Keith, and Dr. Gray. It's just back like the old times. So, all right. Thanks for the comments. David, any other comments?
That appears to be our last request for public comment.
All right. So members, there are some comments. Maybe we could consider comments from Dr. Yoshizuka and Dr. Gray about possibly amending to approved. And go ahead.
So you could maybe say, or a board-approved accredited employer-based training program, because you've already approved ASHP through the statute, and then there'd be flexibility, and you could decide if you want to, at some point, do regulation or approve them, before as they come before the board as a board action.
Maria, what are your thoughts?
So what I heard you say is to add the words a board-approved accredited employer-based program. I'm fine with that.
Okay. Satinder?
I'm okay with that.
Okay. All right. Motion is amended. Ready for public comment in person? Ready for public comment again in WebEx?
We are once again open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request, you wish to continue with the motion?
Yes, please. Thank you. With the motion, a second on public comment. Maria, did you have something?
Yeah, we have a problem because now we've eliminated ASHP.
So I think the statute already allows for ASHP. I think I'll defer to council.
What I heard was a board-approved accredited employer-based program. I think what you're trying to capture is the board approval of the accreditation entity as opposed to saying that you want the employer-based program. So
the intent.
you might consider an employer-based program accredited by a board-approved accreditation
agency.
or something to
How
that
about
effect.
we change it to a board-approved accredited pharmacy technician program? So it doesn't say where it's based out of. Because I don't want to eliminate ASHP.
So I think ASHP is already included in 1736. Let me see.
So just to be safe, what Corinne, your word, I mean, we do not want to wordsmith here, but
I
bigger
think-
picture.
Yeah, if they can clarify the policy, do you want to be approving the program? You want to just be approving the accreditation agency? It's my understanding,
Accreditation
just the
agents.
accreditation agency.
No, because employer-based programs are, what agency do they go to?
They can go to, that's already approved, right?
There's only one.
So right now, but I think what, like what the public discussion was talking about at the board, at the committee meeting was others may step into the space. So like
Okay,
CPHA.
as long as that was
is
discussed with the
already-
public.
Yeah.
As long as that's discussed with the public, because that is the current limitation of employer-based programs. They're not accredited.
Yes,
So
so
as long as that was a discussion of the public, then I am okay with that limitation.
Okay.
So what is the,
Go ahead, Jeff.
can you read it again?
Are you still go? Yeah, before we move on, but if it's confusing for us, how's it going to be for the public? So let's ensure that obviously the wording's right and that there's a good, easy place for somebody who's at home trying to figure out what steps they need to take, that they can find what's appropriate so they can be successful and working in this field. So
Absolutely. Thanks, Jeff.
What was, since it's my motion, Corinne, what was your language?
I believe I suggested an employer-based program accredited by a board-approved accreditation entity.
That's too limiting because they're not all employer-based.
I mean, this is a policy decision for the board because my recollection at the committee meeting was that language was chosen intentionally.
Just for, so that was the niche they were looking at, employer-based. So then, okay, so then maybe I shouldn't make the, since I wasn't involved with the public discussion, maybe someone else should make the motion.
Satinder, do you want to, you were at the committee. You're the only one that was at the committee. So you want to try to capture.
I think the intent was that there'd be a future like CSHP and
BPHA
PHA
could be an accredited.
accrediting agency. Oh, I'm sorry. I guess the discussion during the committee meeting was that they allow for the CSH, California Pharmacists Association, such agencies to be able to accredit programs. So that would be a way for employers to get accreditation of their program instead of sending everything to the board and overwhelm with it, thousands of programs that's coming up to the board to be approved.
We did not want to approve employer-based training program. We wanted the programs to be accredited. That was the hope.
Mhm.
We didn't want to be in the business of approving the training programs, but we wanted the accreditation agency to approve. We wanted employer-based training programs to be accredited. Originally, it was just employer-based training programs. They could be a pharmacy technician trainee, but we wanted them to be accredited at least.
Yeah,
So
but the concern was that at the committee level and also some public was that if you have just employer-based programs and they're not getting approved by the board or the accreditation agency, there is a all levels of training. Someone may be just standing on the counter
Mhm.
and not get any experience and be technicians, which was the problem in the past. So we wanted the public and the board wanted some sort of a accreditation agency to be approving those programs.
So I understand all you're saying. I don't disagree with it. I wasn't at the meeting. So it sounds like you did not discuss non-employer-based programs.
no, that was not part of the.
Okay,
This
that's where,
was-
that's where
yeah.
I'm too far down the line. So
I think that pathway is,
Already exist.
so
No, I mean, like it doesn't exist, but we didn't want to change anything. We just wanted to make it more available than what is today.
Go for it, Satinder.
So I'll try to capture this. I make the motion to amend business and profession code 7038 and 41.1.5 related to pharmacy as discussed during the meeting, which includes employer books program to be approved, employer-based program to be approved by board.
I think you could maybe
Accredited
say
program approved by the board.
accredited by an agency approved by the board.
Yeah, accredited by the agency approved by the board.
You approve, Ms. Corinne?
I'm sorry.
Can you say it
Can
again?
you repeat it?
Great.
Okay.
Hey, Corinne, that you think it's just, we're just beholden to our lawyers here, so come on.
Do you want me to maybe get you started?
Go ahead, go
Okay.
ahead.
A proposal to amend Business and Professions Code 4038B to expand to allow for a pharmacy technician trainee in an employer-based pharmacy technician training program accredited by an agency approved by the board and conforming changes to Business and Professions Code 4115.5.
Well said.
Well said.
Second?
I'll second.
Thank you, Jeff. All right, another public comment here in person. No public comment. We're ready for WebEx.
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. And our first request comes from Richard Dang, CPHA. Hold on just a second. We're sending you a request to unmute your microphone.
In California Pharmacy Association, I think I heard the wording that was proposed and that sounds accurate. I just want to refer back to the existing language that you have in law books. Article 17, continuing education, 4231, requirement for renewal of pharmacist license. Section number 2, the course is approved from an accreditation agency approved by the board. So that's an example of language that you have used before, as well as language under the advanced practice pharmacist certification. There is language on or provided by an entity that is approved by the board. So either entity or agency approved by the board has been referred to in the current law book with current regulatory language. So it sounds like what has been proposed in the motion would be in line with that, and I would be in support of that language.
Thank you for the comments, Dr. Dang.
Next, we're going to hear from Amar Ta. Hold on just a moment. We're going to send you a request to unmute your microphone.
Hello, thank you for the opportunity. My name is Ammar Taha, and I'm a pharmacy student. And I'm just wondering about the pharmacy technician program that if we can consider them like just like a pharmacist licensing steps, like getting like graduating from a program that created by anybody, and then do our the board will administer their own licensing exams, just in a way that you do for the pharmacist, and so that we will guarantee that those will practice in the standards of the board. Thank you for the time. Thank you.
Thank you for the comments.
And that appears to be our last request on this motion.
Thank you, David. With a motion and second, we're ready for vote. Jeff?
Yes.
Thank you, Jeff. KK?
I'll abstain.
Oh, okay. Thank you, Jay.
Yes.
Thank you, Satinder.
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. The motion passes. It is 11:46, so probably an opportune time for us to take a lunch break. Food is not here. Well, our next discussion probably is gonna take a while, so not here yet. Okay, well, we can proceed and we'll see where we land on this one. Okay, next agenda item is discussion and consideration of survey results received related to pharmacist to pharmacy technician ratio. For a number of meetings, the committee has considered the issue of pharmacist to pharmacy technician ratio. The meeting materials detail the current law related to ratios. Members routinely receive public comment indicating that California has one of the most restrictive ratios. As a reminder, review of various state ratios does not necessarily provide an apples to apples comparison, as jurisdictions have varying approaches on provisions for services within a pharmacy, including where some jurisdictions require all pharmacy personnel to be licensed as a pharmacy technician if performing even basic functions such as data entry. This is not the case in California. I continue to highlight that this is only to remind us that when comments are received, context matters. As some background, during the January meeting, members reviewed and approved a draft survey to solicit feedback from pharmacists on this topic. As noted in the meeting materials, the survey was released on March 6, 2024 and ended March 25th, 2024. During the survey period, over 5,100 responses were received. Again, would like to thank everyone who participated in the survey. During the April meeting, the committee received a presentation on results of the survey. During our January meeting, we received additional data from the survey. And attachment 2 to the meeting materials include presentation slides that highlight the data. As I did during the committee meeting, I would again like to extend my gratitude to the experts within the DCA Office of Professional Examination Services for working to develop, deploy, and evaluate the survey results and compiling the additional data for our consideration. As noted during the committee meeting, the data appears to support that the ratio established for the institutional setting remains appropriate. In the non-institutional setting, I believe the data either supports the current ratio or a ratio of 1:2. After consideration, members reached agreement that a change to the current ratio in the non-institutional or community pharmacy setting is appropriate. Also included in the attachment 2 is draft statutory amendment that could be used to change the ratio. You will note that the language provides for a 1:2 ratio, as well as the ability for the board to promulgate regulations for a different ratio. Just like to add a commentary that this is a probably a pretty monumental moment for anyone who's been following the Board of Pharmacy for many years. So just wanted to, take a little moment to realize that this is a pretty big moment for us to consider this motion that is in front of us. So here's with the committee recommendation serving as a motion. I open up for comments. Maria, Satinder?
I greatly appreciate the effort of the committee and all the public that responded. And I think that this is a good motion going forward. I would highly suggest that a new discussion take place about institutional setting. I don't think there was enough information, and solely basing the discussion on the survey is not sufficient. And I know it's not within the scope of the proposal. So I would highly recommend that moving forward, the committee look at institutional setting technician ratios, the varied settings, and have a robust discussion on that.
I appreciate the comment, and I will absolutely bring that up to licensing committee as soon as possible, discussing changes to our regulation for institutional setting ratio. Any other comments? No comment? No comments? Exciting moment. Okay. Nicole, no comment? Okay. Ready for public comment in Sacramento?
Thank you, Mark Johnson, CBS Health. Thank you for considering an increase in the ratio. My one comment is in line with some of the letters that I saw that were in the materials from other entities. the way this was structured, in order for a technician to transfer, clarify, and do CLIA wave tests, they have to take 6 hours of immunization training. And that doesn't seem to make much sense. If we're opening this up, this is a good opportunity to change that. I would go as far as saying that 90% or so of the prescriptions at CVS Health are electronic. And soon, my understanding is SureScripts will have the ability to transfer these prescriptions electronically, which is a tech basically hitting an enter button. Do they really even need to be PTCB certified to be able to transfer an electronic prescription? So I think there's some room to look at those tech duties that the second tech on duty can perform, and what the training requirements are, and if it really even has to be the second tech on duty to transfer. Thank you for the
comments, Mark.
consideration.
We are going to talk about that in the future in the sunset report discussion, Mark, and also when the SureScript thing happens. Can you please let us know as soon as possible? Thank you.
We have to get past CMS first. Good morning, Lori Walmsley with Walgreens. Really appreciate the board's discussion and with the motion potentially to move forward the changes with the ratio. I think this is a good common sense approach to give the board a little bit more flexibility. As you continue to hear, and as Dr. Serpa eloquently mentioned, there are a number of different types of environments that exist today that didn't exist when this law was originally passed. And you want to be able to have the flexibility to be nimble and move things forward as practice settings change, as technology is advanced, and all of those kinds of things. So I think this is a good compromise and appreciate the board looking to move it forward. Thank you.
Thank you for the comments, Lori. There are no in-person comments. Ready for WebEx. David?
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand. And don't be afraid to put those hands up early. Our first hand comes from Stephen Gray. Hold on just a second. We're sending you a request to unmute your microphone.
Thank you very much. I also support the motion on the floor and as it is worded. I will comment, though, that it is basically identical to what the board's ability is for the inpatient or the hospital setting, institutional setting, where it has the ability upon a request to change the ratio listed. Just to provide some additional information, we've been working on this ratio issue for over 2 or 3 decades. And I was involved right from the start when we created the outpatient pharmacy technician in law, which did not exist before the mid-90s. And what was interesting, we did several surveys of hospitals, and we found it interesting, and this is directed at board member Serpa's comment, that there wasn't ever a single hospital that applied to the Board of Pharmacy to have an increase in the ratio. And I don't know whether that was because there wasn't the need, or it didn't fit the operation, or simply that a lot of the hospitals didn't realize they had the ability to do that. So as we go forward, it's going to be important for the board to have feedback from the community pharmacy industry about whether the board should consider modifying a regulation to increase the ratio either under certain generally available operational flows or in other specific instances that may be very unique. So just again, support this. It's a long time coming, it's overdue, and it really should help overall the work-life satisfaction of pharmacists and others in our community pharmacies. Thank you.
Thank you for the comments, Dr. Gray.
Next, we're going to hear from Richard Dang, followed by Keith Yoshizuka. Hold on just a second, Richard. We're sending you a request to unmute your microphone. All right, Richard, we're going to try again.
There we go. Hi, Richard Dang, California Pharmacists Association. Just want to thank the board and the committee for working on this very important topic. I support the motion that is being put forth and agree with all the comments that have been made by Maria, Lori, and Steve prior to me. Thank you.
Thank you for the comments, Dr. Deng.
And next, Keith Yoshizuka.
Keith Yoshizuka, speaking for the California Society of Health System Pharmacists. We want to go on record as supporting the notion to give the Board of Pharmacy the authority to change and modify the tech ratios in community pharmacies by regulation. Thank you. It's been a long time coming.
Thank you for the comments, Dr. Yoshizuka.
And that appears to be our last request on this.
Thank you, David. With the motion, motion serving as a motion, we're ready for a vote. Jeff, how do you vote?
Yes.
Thank you, KK.
Yes.
Thank you, Jay.
Yes.
Thank you, Satinder.
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. The motion passes. It is 11:58, perfect time for lunch. And so we will take lunch break until 12:45 p.m. Please come back at 12:45. All right. Jeff?
Public member present.
Thank you, KK.
Licensee member present.
Thank you, KK. Jay?
Public member present.
Thank you, Satinder.
Licensee member present.
Thank you, Maria.
Licensee member present.
Thank you, Nicole.
Licensee member present.
Thank you, and I'm here. A quorum is established. Moving right on to the next agenda item in licensing committee, discussion and consideration of proposal to establish reinstatement of a retired pharmacist license. You may recall that following a request from the public, the board referred this item to the committee for consideration. Background information is included in the meeting materials, but to summarize, public comments suggested that the board consider development of a step-down licensure process for pharmacists getting ready to retire. It was suggested through public comment that the board consider the approach used by Nevada. During our previous discussion on this issue, we considered provision in Nevada's law that provided a pharmacist who has been registered with Nevada for at least 50 years is not required to pay renewal fees after that time. During our prior discussion and following feedback from members during the April board meeting, staff have reviewed additional provisions that allow for reinstatement of a license from an inactive status. It is staff's understanding that Nevada relies on the reactivation provisions when restoring a previously retired pharmacist license. Attachment 3 to the meeting materials include a copy of proposed amendments to Business and Professions Code Section 4200.5 that would establish limited provisions for restoration of a retired license. As a committee, we noted that the proposal as drafted is similar in concept to both the Nevada model, but also the current provisions in the board's law related to reactivating an inactive or retired pharmacist license. Please note that the committee is offering a recommendation which will serve as our motion. Members, any comments? Go ahead, Maria.
Like yourself, I don't like to be the first one.
Oh, I know, but I was just a mess yesterday, wasn't I?
Okay. I'd like to thank the committee for taking the recommendations and the discussion that we had at the previous board meeting and to even discuss this subject. I think that members of the public have been talking about this issue for some time and encourage them to use the time to bring issues to our attention. And this was one of them that was brought up during the agenda item of issues of not on the agenda. So I encourage the public to do that and thank the committee for their work.
Thank you, Maria. Any other comments, members? Seeing none, we're ready for public comment in Sacramento. No public comment in Sacramento, ready for public comment in WebEx.
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of your screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. As a reminder to our mobile device users, if you're having trouble finding that hand button, you can hit the ellipses button, that's the ... and cycle through the 3 different pages in order to find your hand button. And for those who have keyboards only, you may type the word comment into the Q&A box in the lower right-hand corner of the screen and send that comment to all participants. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue?
Yes, please. Thank you, David. I am really appreciative of this motion and the work that we've done here for this item. I think this is a good balanced approach we were able to land. Jeff, how do you vote?
Yes.
Thank you, Jeff. KK?
Yes.
Thank you, Jay.
Yes.
Thank you, Satinder.
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. Hopefully, I can just be a retired pharmacist soon. Next is discussion and consideration of a compounding by pharmacy technician outside of pharmacies. This next item for discussion was referred to the licensing committee from the enforcement and compounding committee. The licensing committee has discussed the requirements for licensure for a pharmacy technician. By definition, pharmacy technicians work in a pharmacy under the direct supervision and control of a pharmacist. Related specifically to this agenda topic as well, a quick reminder, Federal Law Section 503A of the Food, Drug, and Cosmetic Act makes clear that the authority to compound a drug preparation is in part predicated on compliance with USP compounding chapters. Also, as a reminder, USP General Chapter 797 describes the minimum requirements that apply to all persons who prepare compounded sterile preparations and all places where sterile preparations are compounded. This includes pharmacists and pharmacy technicians compounding in all places, including those areas outside of pharmacy. The committee's past discussion of this topic included consideration of a number of policy questions. A summary of the discussion is included in the meeting materials, so I will refrain from going into detail. But again, highlighting that members agree it is the board's role to safeguard the health and safety of the public, and this role is memorialized in Business and Professions Code Section 4008. During the committee's July meeting, the members considered a proposal to amend a provision of Business and Professions Code Section 4115 to establish clear authority for a pharmacy technician to compound under the direct supervision and control of a pharmacist outside of a licensed pharmacy. Further, as proposed, a notification requirement would be established. As mentioned during the committee's discussion, the notification requirement will assist the board in directing resources to those locations for inspections. The language is included in the attachment 4. Members, any comments or questions? You'll be the first one, Maria.
Again, I wanted to thank the committee for discussing this issue and coming to a very good resolution. I think this in part takes care of some of the concerns that we had in the Enforcement and Compounding Committee. I would highly suggest that this issue and the wording be communicated with both licensed technicians and licensed pharmacists. Many pharmacists and technicians were unaware of the previous information, and there are technicians that are currently working in locations without a pharmacist. And there are tech pharmacists who are supervising technicians in unlicensed locations. So this helps with that part, but the notification, I think, is important. So I'd encourage that there be quite a bit of communication about in education.
Thank you, Maria. KK?
I think Maria covered it, what I wanted to say, but I think it firmly establishes the duality of pharmacist or technician without pharmacist and pharmaceutical work in unlicensed place. So both things are addressed here. So that's pretty good.
Thank you. All right. With that, public comment in person. Seeing none, we're ready for public comment in WebEx.
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. And our first request comes from Stephen Gray. Hold on just a second. We're sending you a request to unmute your microphone. All right, we're going to try Stephen Gray again.
I got it. A little bit slow in the interspace.
No worries.
Thank you very much for the opportunity to comment on this very important subject. Generally speaking, I am in favor of it. I think it's a good idea. It's happening anyway, and this would indicate that the notification and that a pharmacist must be, have direct supervision and control. And there's a couple of things there that when you really look at the history of what it means to have direct supervision and control, it means that the technician has to report directly. So it's not just a physical direct supervision if that's what is required, but the person has to report to the pharmacist. And that was a big issue when we had technicians in hospitals, and some hospitals wanted the pharmacy technicians that were in the satellite pharmacies up on the floors to report to the nurse on the floor. So that direct supervision, that's partly why that was chosen. And this takes care of that, but it's important to understand that relationship and that it has to report to that pharmacist. The second thing, though, is a little more problematic in that the wording of the proposal is contradictory to current statutory law. Statutory law explicitly says, and I'm sorry, I was just looking for the place, but it says under California law that only a pharmacist can do compounding, and it uses that word compounding. And what it says in this is that technicians can do activities that don't require basically the professional judgment of a pharmacist. And that was followed by the regulation, and the regulation defines those. They don't define it as a technician doing compounding. They define it as a technician doing mixing, pouring, and labeling. You will not find anything in the current law that says regulation or statute that a technician can do compounding, because the statute explicitly says that is restricted to a pharmacist, and that compounding has many other factors besides mixing, pouring, packaging, and labeling. For an example, a pharmacist has to create the master formula and has to do other things, sign off on it, and so forth. So I would recommend changing the motion to perform the activities that are listed in the regulation related to technician activities related to compounding, but not technically actually doing compounding. Thank you.
Thank you for the comments, Dr. Gray.
And that was our only request on this topic.
Thank you, David. Okay, with a public comment, with a committee recommendation serving as a motion. Ready for a vote? Jeff, how do you vote?
Yes.
Thank you, AK.
Yes.
Thank you, Jay.
Yes.
Thank you, Satinder.
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. Next agenda item is we're skipping presentation on central fill pharmacy models and going straight into the discussion and consideration of proposed amendment to California Code of Regulations Title 16, Section 1707.4 related to central fill pharmacies. Following the presentations and discussions over several committee meetings, members considered proposed changes to the board's central fill regulation. Provided in attachment 6 are proposed amendments to the board's regulation that are being recommended by the licensing committee. To facilitate review, I thought it may be helpful for me to summarize some of the proposed changes that are intended to clarify the current regulation, where some comments have suggested the language is not clear or have sought guidance on how to interpret or implement the language. First, throughout the language, you will notice that reference to refill is being removed. The prior language appeared to have conflicting language, causing confusion about the ability of central fill pharmacies to fill new prescriptions. The proposed change in 1707.4A seeks to clarify that both the Central Fill Pharmacy and the other pharmacy are both licensed by and operated within California. I believe this is providing clarity only as the existing language of the regulation specifically includes the term within this state. As I stated, during the committee meeting, prior public comment has suggested that we should not limit these provisions to pharmacies located in California. I believe that would be an expansion to our current regulation. Therefore, I'd like to continue our proposed text. Next, the proposed change is 1707A2B is intended to clarify that the originating and central fill pharmacies have the flexibility to include the name and address of both pharmacies if they so choose. As I did during the committee meeting, I want to note that the pharmacy identified on the prescription label would need to have sufficient staff and to have access to all information necessary to assist the patient. Another proposed change is 1707.4A5 would establish a permissive requirement for the originating pharmacy to perform final product verification prior to dispensing and allow for the final product verification to be done by viewing photographs in lieu of a physical visual inspection. And last, 1707.4B, which provides a definition of central fill pharmacy. All right, members, I'm sure you'll have some comments on this item, but the committee's recommendation is serving as our motion. Any comments, members?
Just a couple of clarifications,
Go
if
ahead,
I may.
KK.
So the PDF, it's page 87, otherwise 1707.4, subsection A.2, sorry, subsection A.5. A pharmacy which fills the prescription and the pharmacy to which the prescription is provided for dispensing, pharmacists working at the originating pharmacy may perform final product verification. This will be a SOP-based may verification, or is it a discretion of a pharmacist at the time present, or is it like a procedurally a PIC's decision that I sufficiently trust the second pharmacy, I don't need to do it as general, or is it certain percentage that is required that will be enforced by inspector? What is that may?
Thank you for the
will end
comments,
up-
KK. Do you want to say to that anything to that? I think that from the committee's discussion, the idea is just to provide flexibility so that a facility in ensuring that if it's not possible for the product to be manipulated further, then the idea is that the medications that are filled by the robot at the time does not need to be checked. So it's just giving flexibility.
Okay. And then if the quote unquote refilling pharmacy, not the originating pharmacy, the second pharmacy is distributing the drug directly or delivering the drug directly to the facilities licensed under 1250, what is the responsibility of that second refilling, again, quote unquote refilling pharmacy? Because they are generally exempted to directly counsel the patient. They are required to provide a phone number. Here it says the notification is needed.
Go ahead, jump in. And I believe that, yeah.
Yeah, so I think that that's the activity that you just described would not fall under our definition of central fill. I think that that would probably be more like a mail
Mail
order
order.
or closed door. So that in that case, these would not apply. Does that make sense?
Okay, yeah. I like I said, there are so many use cases that involves more than one pharmacy, more than one distribution channel, more than one dispensing, as well as delivering pharmacies, institutional versus retail, and sometimes both are mixed under one roof. There are certain patients who come and pick up, and then large majority will get a delivery. So I want to make sure that this is specific to a action and not specific to a kind of a pharmacy.
Yeah, so how we've defined central fill, it includes that it prepares and packages prescriptions for another pharmacy to dispense to the patient.
Thank you.
I have a comment. I guess I didn't notice when we were originally reviewing it, but it's a 1707.4A, another pharmacy within this state. So I would think that the central fill pharmacy, we should allow them to be like fill for prescriptions that are outside of the state too. Like it could be pharmacy outside of the state that could also receive, but it would be regulated by here. You know, like it would limit, why are we limiting, you know, they could be filling for, let's say, in California and want to deliver to Arizona or.
So the other way, yeah.
So just leave it at the pharmacy portion and strike the word within the state.
They have to be in the state, but they can send it outside.
Yeah.
I would be amenable to that, but I would not be amenable to the other way, but I
Yeah,
would be
yeah.
amenable to that way. Yes,
That's what
good points, Atinder. Members?
So I have a question about some areas of confusion, and I think it's because I'm naive to this. I'm reading it for not for the first time, but as not part of the committee. So some of the wording that's here. So I see where it says in B, it says pharmacy which receives the medication to dispense. So that's very clear. What's also clear is in 3, it says central fill pharmacy. Then when you go down to 5, it's a little bit different where it says pharmacy to which the prescription will be provided for dispensing. So it's a little bit different, but I assume that's exactly the same pharmacy that you were referring to in B. That's the first part. That is an easy assumption to make, but I just wanted to make sure that assumption is correct.
Mhm.
The part that threw me a little bit more was in both 5 and 6, and President O, you kept on referring to also originating pharmacy.
Mhm.
I don't think that's clear. Originating, is that the same as the pharmacy that receives and the pharmacy that's about to dispense? The central fill pharmacy could be the originating pharmacy because that's actually where the drugs originate from. So I'm thinking that originating pharmacy in both 5 and 6 should be clarified. And if you also wanted to clarify pharmacy to which the providing is being dispensed, I'm okay with that because theoretically, according to this has proposed, this is 3, it could be 3 different pharmacies. You could have the refill being requested at pharmacy A, being filled at central pharmacy B, and being dispensed to the patient in pharmacy C. And that's okay with me if that's what the committee wanted. My originating pharmacy, I think does need to be clarified.
Okay, sounds good. So to do that, we would have to vote down this motion. So just wanted to, which I'm amenable to it. Any other comments before we open up for public comment? Just wanna, okay. Public comment in Sacramento? Lori?
Good afternoon, board members. Lori Walmsley on behalf of Walgreens. First off, really appreciate the changes that have been made to the regulation as the committee has continued to discuss this. I would like to support the comment that Dr. Sandhu made. I understand that the board wants to have control over what happens with the central fill. Since the pharmacy that would be receiving the medications wouldn't be doing work for any California patients, I don't see why that should be a potential limitation. So I'm supportive of that and that modification. I do agree with your comments, Maria, about the language of originating pharmacy being a little bit confusing. So making sure that the language is cohesive throughout the rule is a good idea. The one other thing that I wanted to bring forward to the group that I mentioned in the committee is around the notification requirements. That isn't something that you mentioned in your original summary. Dr. O, it is under B3. The patient is provided with written information indicating that the prescription may be filled at a central fill pharmacy, and information either on the prescription label or the prescription container that describes which pharmacy to contact. I'm in agreement with all the part around the labeling piece of it, but the written information prior to filling I do think is kind of limiting. Most other states that have a notification requirement do allow for the placement of a sign versus individual written notification. And since you're expanding this to new prescriptions, I would also hate to see there be a delay in therapy for the patients because they need to receive the written notification and approve that before it is able to be sent to the patient. So really appreciate the work and think this is moving along in a really good direction. So thank you.
Thank you for the comments, Lori. Mark, thanks for making us feel like home again.
Thank you, Mark Johnston, CVS Health. Two of my three comments are in harmony with what Lori just said, so I won't belabor them. It's allowing a California central fill to service out-of-state pharmacies and thus not California residents. The second is the written information. It's written in the future tense. Written information indicating the prescription may be filled. Really, if it isn't a sign that notifies the patient, that means every single patient in the pharmacy would have to be given written information that potentially in the future, maybe your prescription would be essentially filled. Maybe this could be, that the tense could be changed, like written information indicating that the prescription has been filled, or to Lori's point, a sign would give, future tense notice. But, as it's stated here, you don't really identify the patient on a new prescription ahead of time like this. So I think it's a verb tense issue. The last thing is something I mentioned last time too. I don't think photographs is the technically correct term. I think it's images. Photographs are something that, a handheld device took in the 50s. I think computers take images.
Thank you, Mark. Thanks for correcting us on the terms. All right. No public comment in person, so we will go to public comment in WebEx.
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. And our first request comes from John Gray. You may need to dial *6 in order to unmute.
Hi, good afternoon. This is John Gray, registered pharmacist with Kaiser Permanente. Thanks for the opportunity to comment. Again, I'll give my standard caveat that I've been giving throughout the discussion of this agenda item, which is the Kaiser Permanente does not currently operate central fill pharmacies in California, although we have in the past. We first want to say we appreciate the board's deliberate and thoughtful approach to updating this regulation. Really appreciate all the opportunities to discuss this. Thank you very much for including language that addresses the conditions under which final product verification by a pharmacist need not be performed in a central fill pharmacy. We very much appreciate that addition. And also wanted to say we also agree with Board Member Serpa's observation that this kind of ping-ponging language between central fill pharmacy and originating pharmacy can be confusing. In a previous letter to the licensing committee, we had suggested the addition of another definition under sub C, a new sub C, that could say something like, for the purposes of this section, originating pharmacy means a pharmacy that receives a patient's or prescriber's or receives a patient's or a prescribing practitioner's request to fill a prescription, or something to that effect, thus clarifying wherever the term originating pharmacy is used, what exactly that means. Thanks very much for the opportunity to comment.
Thank you for the comments, Dr. Gray.
Next, we're going to hear from Stephen Gray. Hold on just a moment. We're sending you a request to unmute your microphone.
Thank you again very much. I am very much in favor of the original intent of the modification of this regulation to make it clear that central fill pharmacies could also fill new prescriptions, not just refill. Subsection B did say that, but anything that makes that more clear, I think is very important. I do find, however, that I opened the first central fill pharmacy in California, and I think there is a problem with the red lettering where it says a pharmacist shall not be required to perform product verification where product verification has been performed at the time of stocking. During the discussion, there was a lot of discussion about the automation devices that fill pills and tablets and capsules in vials. But these operations also have other devices that basically take the order and present to a technician a full bottle, a unit of use that already has a child-safe cap on it, has the right quantity in it, and the technician applies the label to the full bottle, whether it be tablets, capsules, liquids, an ointment tube, a birth control package, and so forth. During the discussions with the Board of Pharmacy who visited our site, they basically said that when the machine is not putting the tablets and capsules, for an example, all into an already labeled container, then that does have to be verified by a pharmacist, because we all know that significant mistakes can be made when the wrong label is applied by a technician to the wrong bottle, vial, capsule, tube, ointment, etc. So it should be clarified in the regulation that that exception applies basically only when the machine is putting the product into an already labeled container that identifies the patients. That's where the accuracy comes from. Using barcode technology, etc. The label then is what keys the machine to put the product in the container. If that label isn't already on there and a technician applies the label, serious mistakes can be and have been made. So I would recommend reconsidering that language, since you're probably going to reconsider some of the language. I also agree that the flip-flop back and forth between original and all of that. And I want to point out again that Regulation 1713A already allows any prescription to be transmitted to another, quote, retail pharmacy, or several other places to be picked up by a patient. So you need to understand the interplay between those two regulations.
Thank you for the comments, Dr. Gray.
Next, we're going to hear from Timmy Hong. Hold on just a moment. We're going to send you a request to unmute your microphone.
This is Cardinal Health. I just want to come out and support the idea.
Sorry, Timmy, you sound very faint.
Oh, can you guys hear me? Is it better?
Yes.
Yes, sorry about that. So Timmy Hong, Cardinal Health pharmacist. Just coming out to support the idea to have a California located central fill, to have the ability to ship out of state, just because that opportunity really opens up career opportunities for California licensed pharmacists and technicians, just to have a California licensed central fill to be able to ship out of state. So thank you for the opportunity.
Thank you for the comments.
And that was our last request for public comment on this topic.
Thank you, David. Okay, with that, thanks for the comments, everyone. I think that my recommendation is we vote down this motion, and we will hopefully have a new motion that's that incorporates a lot of comments. That great comments were received. All right, with that, members, Jeff.
No.
Thank you, KK.
Are we rejecting so we can?
Yeah.
Okay, no.
We're denying the committee recommendation. Jay?
No.
Thank you, Satinder.
No.
Thank you, Maria.
No.
Thank you, Nicole.
No.
Thank you, and I vote no. So I think there's a lot of great comments. So first, we could definitely amend it so that the pharmacy within the state under 1707 4A, another pharmacy within or outside of the state, I think could be worked. Under 1707.4A3, I would like to provide an opportunity for pharmacists to be able to not have to wait until the written information. I would like it to be a more of a FYI to patients that this happened, not or some kind of a notice or written notice at the pharmacy level. I don't want it to be a hindrance of that farm prescription. Curious for members' thoughts on that. I think that we could clarify even further the originating pharmacy. I again, like Maria yesterday, I've read this so many times. To me, or it's a confirmation bias. So I feel like originating pharmacy is definitely the pharmacy where patient's prescription, not the medication, but the prescription was sent to originally, right? But I think we could just clarify, just to satisfy photographs, since I guess it's an old word. I'm open to changing to imaging or whatever it is that the lawyers would approve us to use. Also, lastly, I totally appreciate Dr. Gray's comment that I would like to state something that dispensing device is not further accessed by pharmacy personnel, and also that the labeled prescription bottle, it is a labeled prescription bottle, not an empty bottle with pills. So again, we can't wordsmith here. Jennifer is here, thankfully, so hopefully she'll help us proceed forward. And anyone wants to make a bold motion incorporating these changes consistent with the committee discussion, if that's okay, regulatory purposes, and then hopefully you guys can work it on the background, and then the text can be noticed. So, Maria, go ahead.
I'd like to consider one specific direct role of direction instead. Someone, I don't know who, I forgot who made the comment, but I do appreciate that. I'm sorry, I'm not recognizing you. Instead of changing 5 and 6 in the originating pharmacy, is to divide that definition further up, may be helpful, instead of trying to, instead of trying to fix the ones below, defining it above may be helpful.
Yeah, like originating pharmacy is a pharmacy that receives a prescription. Dispensing or central for pharmacy is a pharmacy that ships and fills the medication or something.
And the receiving is the, final
Okay.
dispenser.
Is that clear to you, Anne? Just breaking down the definition at first. So
I would suggest that. So I'm trying to track all of this. I'm wondering, should we either as part of a motion moving forward, as long as the body is all clear on what the policy is, maybe delegate to the chairperson to, confirm the changes before, we notice it or whatever, right? As long as everybody's, or we can send it back to committee to continue workshopping it.
I think it's ready to move.
Yeah.
It's a regulatory, this is just one step. Remember, our last regulation was like starting in January of 2022. So I would just like us to move forward. So if anyone wants to make a motion incorporating these changes and delegating to Chair of Licensing and Executive Officer of Language Wordsmithing, consistent with our discussion today, if that's agreeable. Members?
Yeah, so I think a possible motion could be to amend California Code of Regulations 1707.4 as included in the meeting materials with additional changes to amendments as detailed. And then if you want to include in the motion what those are, we can.
Do you want to try, Satinder? Maria?
Go ahead.
No one wants to volunteer. So moved. Can I do that?
So move. Well, we have Jennifer today. Jennifer? Stop us.
All good.
Good, okay. Second?
Second.
I'll second.
Okay, all right, okay. Well, I'm gonna give to Jay, because thanks to Tinder, Jay. Thank you, Jay. All right, with that, public comment in person, please.
President O, this is
I'm
David, the
getting to you,
moderator.
David. Sorry, I didn't know that I had, okay, thank you. I did it.
Thank you.
Go ahead, Lori.
Lori Wamsley on behalf of Walgreens. I really appreciate the suggested changes, definitely in favor of what all the changes sound like they will come out to be. So looking forward to seeing hopefully the modified text out for comment.
Thank you, Lori. Okay, ready for WebEx?
If you'd like to make a public comment via WebEx, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. And our first request comes from Stephen Gray. Hold on just a moment. We're sending you a request to unmute your microphone.
Thank you. Thank you again for the opportunity to comment. I just want to be clear that the wording in red in subsection 5, pharmacists shall not be required, that my comment was that the pharmacist should be required unless the label was already there before the product was selected. Again, I give you an example of that there are machines that operate in these facilities are not only putting pills or tablets and capsules in vials, but they're dispensing unlabeled bottles of pills, unit of use for a technician to apply the label, eye ointments, some very serious medication, sometimes even boxes of injectable products. And I do believe that wording is not clear, that when that situation applies, a pharmacist still should be the one that makes sure that the label is attached to the right product. Because there can be errors again when the humans are attaching that label and believe it to be, because the machines present these products to the technician at very rapid speed. One tote after another, out comes a bunch of labels. They reach in, they grab one of the bottles in the tote, and then apply the label. And my experience has been that's where the serious mistakes are made, where it's not. So I support the motion, but I think that wording needs to be looked at very carefully.
Thank you for the comments, Dr. Gray.
And that was our only request on this topic.
Thank you, David. All right, we are ready for vote. Jeff, how do you vote?
Yes.
Thank you, KK.
Yes.
Thank you, Jay.
Yes.
Thank you, Satinder.
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. Motion passes. The next, discussion and consideration of licensure and other requirements for non-resident pharmacies. As I have previously shared, I'm concerned about the board's inability to effectively regulate non-resident pharmacies, including mail order pharmacies. Non-resident pharmacies can create unique challenges for patients. I can recall investigations that resulted in discipline stemming from these challenges, placing patients at risk. As I shared during our last meeting, over the last 2 years, the board has referred 11 non-resident pharmacies to the Office of the Attorney General for formal discipline and issued 39 citations. In addition, the board took disciplinary action on 12 non-resident pharmacies. The underlying violations vary in egregiousness and include extremely serious causes of action, including clearly excessive furnishing of controlled substances. As a reminder, there is currently no requirements for pharmacists working in these non-resident pharmacies and providing services to California patients to be licensed in California. Pharmacists to be licensed in California. As a quick reminder, the board has previously voted and will be pursuing a statutory change already to require the pharmacist in charge of a non-resident pharmacy to be licensed in California. During the July meeting, the committee continued its discussion of this issue and considered proposed amendments to Business and Professions Code Section 4112. As I shared during the committee meeting, some states have implemented changes to eliminate law and jurisprudence examination. In addition, recent actions by Michigan and North Dakota allow pharmacists licensed in Canada to reciprocate licensure without taking the NAPLEX, which is the North American Pharmacist Licensure Examination. The committee is recommending changes to Business and Professions Code Section 4112 to update requirements for pharmacists working in a non-resident pharmacy who are not licensed in California, as well as to establish provisions for mandatory inspections of non-resident pharmacies. Attachment 7 includes a copy of the text recommended by the committee. I want to highlight that the language does not require all pharmacists working in non-resident pharmacies to be licensed in California. It does, however, establish certain parameters that apply in order for pharmacists who are not licensed in California to provide services to California patients. Further, as proposed, the language would prohibit a pharmacist whose license has been revoked in any jurisdictions from providing services to California patients unless his license was subsequently reinstated or reissued. With the committee's recommendation serving as our motion, do you have any questions or comments on this next agenda item? Licensure and other requirements for non-resident pharmacies, including proposed amendment to BPC 4112. Maria, go ahead. You're the first one.
I'd like to thank the committee for addressing this issue. This is an issue that was important to the Enforcement and Compounding Committee, and we made reference to in our strategic plan goals. So appreciate where this is going and total support.
Thank you, Maria. Other comments before we open up for public comment in person? Public comment in person.
Mark Johnston, CVS Health. I think you're overreacting here. First off, I got a hold of the Michigan Board of Pharmacy. They've issued 36 licenses to Canadian pharmacists. Is it worth your statutory effort for 36 pharmacists that might or might not work at a mail order facility that might touch a California prescription? The language is also confusing. I would argue that it's grammatically incorrect and still needs a little bit of work. Second, you mentioned 12 non-resident disciplines. I'm going to guess that in your closed session today, you probably addressed more than 12 in-state issues. Your goal of inspecting pharmacies every 4 years in California, I don't believe is met when I look at the enforcement statistics that were in the meeting materials. I think you probably would have a greater impact on public safety if you concentrated within your borders. Other states are counting on you to inspect your own pharmacies because they're not coming to California to inspect them, as opposed to you potentially going to non-residents that might have VIPS accreditation through NABP, might be accredited with URAC, might have a number of other accreditations. Their home state board of pharmacy might have been in the week before, and you're going to concentrate on that non-resident pharmacy versus kind of the glaring amount of pharmacies in your own state that are not inspected. So I would suggest that at a very minimum, you put qualifiers in, if not inspected by the home state pharmacy in X amount of years, if not accredited, if not NABP VIP certified, hone it down to, where you really think there's a problem, or it certainly seems like a misappropriation of funds to me. Thank you.
Thank you for the comments, Mark. Got one more in Sacramento.
Hello again, Lori Walmsley on behalf of Walgreens. I do appreciate the fact that the board is moving towards the direction of only requiring a PIC at the non-resident pharmacy to be California licensed versus what the discussion originally started with, which was that all pharmacists would need to be potentially licensed in California. I do want to call out that I don't believe that the CPJE is offered in all 50 states, and that might have changed. But there are some things that may be problematic for pharmacies to ensure that they're able to do that. So if if this moves forward, looking at some sort of phasing in process to ensure that pharmacies have the appropriate time to get that person licensed and also create redundancy and backup plans. So that way there is not a gap in care for patients for California. A lot of the non-resident pharmacies provide things like specialty medications that may not be otherwise available in the state. And I would hate to see for a patient to lose access to a product because somebody left a pharmacy or some of those kinds of things, since could be potentially travel required. A pharmacist like myself that's been licensed for a long time may have to retake the Naplex, those types of things as well. So just some things to consider on what that might look like, and perhaps if there's a way that you could build in a buffer to make sure that patients don't lose access in case they lose somebody that has that license. Thank you.
Thank you for the comments, Lori. Seems like there's no other in person. We're ready for WebEx. David.
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. And our first request comes from John Gray. Hold on just a moment. We're sending you a request to unmute your microphone.
Hi, good afternoon. This is John Gray, registered pharmacist with Kaiser Permanente. Really just want to echo some of the sentiments of my colleague Mark Johnston. We would encourage the board to consider whether it is really the best use of board resources, recognizing that the proposal requires a licensee to fund travel, but whether it is the best use of the board's resources to require inspections of all non-resident pharmacies, or whether there are cases in which it would be appropriate to accept inspection reports from the home state's Board of Pharmacy or third-party organizations such as NABP's VPP. You know, I have experience with other boards and the kinds of the inspections that they perform and the level of scrutiny that they go into, and particularly other states along the West Coast, which I have the most knowledge of, are equally complete in their inspections of pharmacies. So again, just encourage you to think about whether there's language in many other states yielding to recent inspections by the home state board. So again, would encourage you to consider whether that's a reasonable approach. Would also encourage the board to consider whether it might be worth asking for a presentation from NABP on the VPP program. Thanks very much for the opportunity to comment.
Thank you for the comments, Dr. Gray.
Next, we're going to hear from Stephen Gray. Hold on just a moment. We're sending you a request to unmute your microphone.
Thank you very much. I'm generally speaking, I'm very supportive of the direction you're going. However, I find that in the proposed language 4112 subsection G2 is very confusing, and I'm not sure it says what you really are intended. What if the person is licensed in California, but did not take the multi-state jurisprudence exam? In other words, they're licensed in California, but they weren't required to take the multi-state jurisprudence exam in California ever, and they might not even take the NAPLEX if they were licensed in got their license in California before, I believe it is 2004 or 2000 thereabouts. So do you really want to exclude? And the reason I bring this up, there have been pharmacists who are still licensed in California that have moved out of state for tax reasons and other reasons that are working in these facilities. And do you really want to exclude them from being able, or having them after 30, 40 years of practice to go take the NAPLEX again or the multi-state? There are also, of course, states like Idaho that don't even require a law exam, and you're excluding basically anybody who is, if one of these non-resident pharmacies is in Idaho and all of their staff haven't taken the law exam. And I think there's other states that have either done that or are thinking about doing it. So I would recommend not going forward with this language and to really reconsider the implications of subsection 2 of subsection G and the various problems that could represent. Thank you.
Thank you for the comments, Dr. Gray.
And that appears to be our last request for public comment.
Thank you, David. Okay, with a motion and public comment, we're ready for a vote. Members, Jeff?
Yes.
Thank you, KK.
Yes.
Thank you, Jay.
Yes.
Thank you, Satinder.
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. The motion passes. The next agenda item was the discussion and consideration of proposed amendments to pharmacy law to transition to a more robust standard of care model. But we're postponing that discussion. And so moving to the next discussion, which is discussion and consideration of Senate Bill 523, statutes of 2022 related to contraception access, including possible amendments to Business and Professions Code, Section 4052 and 4052.3. As included in the meeting materials, Senate Bill 523 made changes to expand coverage of contraception by a healthcare facility, plan, contract, or health insurance policy. As part of these changes, over-the-counter FDA-approved contraceptive drugs are now covered under specified conditions. However, regrettably, implementation of the policy goal of the measure has not been realized because of reimbursement requirements, most notably requirements by payers to have a prescription to reimburse for medications. To remedy this, the committee is recommending a change to Business and Professions Code Section 4052.3 and potentially a conforming changes to Business and Professions Code Section 4052. I would like to highlight, though, as noted in my committee meeting, in our committee discussion, and if the board's standard of care proposal is enacted, the proposed changes we are discussing under this agenda item would not be necessary. But this would be at least a step forward solution in the meantime to ensure that this policy goal of the legislation SB 523 can actually be implemented. With that, the committee is offering a recommendation. Members, any comments? Seeing none. Nicole? Okay, we're ready for public comment in person.
Lori Walmsley on behalf of Walgreens. Just wanted to say thank you to the board for bringing this forward. I think this is a wonderful potential change to the current statute that exists and will definitely increase access to these products for the citizens of California. So I'm definitely supportive of this. Thank you.
Thank you for the comments, Lori. Seeing none, ready for WebEx.
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand. And for our mobile device users, if you're having trouble finding that hand button, please tap the ellipses button, that's the ... and cycle through the 3 different pages in order to find your hand button. We're going to take just a few seconds now to see if we have a request for public comment. For those who have keyboard only, we have the Q&A box in the lower right-hand corner of the screen, and you may type the word comment. Seeing no request for public comment, do you wish to continue?
Yes, please. Thank you, David. With the committee recommendation serving as a motion, we're ready, and the public comment, we're ready for vote. Jeff, how do you vote?
Yes.
Thank you, KK.
Yes.
Thank you, Jay.
Yes.
Thank you, Satinder.
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. All right, everyone, appreciate the discussion today on licensing committee. We're also going to skip the discussion on consideration of licensing statistics. So with that, it concludes my report for the licensing committee. So we're ready to move on to agenda item 14, Communication and Public Education Committee. I turn the meeting over to our Vice Chair for the Communication and Public Education Committee, Nicole Tebow, to provide a quick report. Vice Chair Tebow, the floor is yours.
Thank you, President O. On behalf of the Communication and Public Education Committee, I am pleased to provide the board with a summary of the committee's discussion from our July 2024 meeting. Thank you to my fellow members, Renee Barker, KK Jha, Jay Newell, and our chairperson, Jason Weiss. Information on the transition to a new website template, update on the Talk to an Expert consumer poster, and communication and public education activities by staff are included in the meeting materials and will not be discussed today. So our first topic is going to be the draft for educational materials related to IV hydration clinics. In recent years, the U.S. Food and Drug Administration has released warnings about instances of drug products being compounded under insanitary conditions. Many of these warnings stem from compounding occurring in sites that are not regulated by the board or other regulatory agencies, including IV hydration clinics. Although business models vary, such clinics have been identified as operating in a variety of locations, including mobile vans, beauty salons, and gymnasiums. These locations generally do not have the appropriate equipment, storage, or classified areas, nor do they have authorized healthcare professionals performing the sterile compounding. The Enforcement and Compounding Committee considered a draft policy statement during its July 17, 2024 meeting on compounding at IV hydration clinics. During the meeting, members reviewed draft educational materials intended to be provided to personnel at IV hydration clinics, as well as made available on the board's website. The focus of the education is around legal requirements and patient safety considerations for such clinics. During the meeting, members generally spoke in support of the concept of the education and requested that staff work to refine the materials. Members requested that staff work with Member Barker to incorporate edits requested by the committee and to provide an updated version for the board's consideration. Following the meeting, staff had an opportunity to work with Member Barker. Some of the significant changes made to the document include: 1, reorganizing the information and simplifying the language to more explicitly state the potential harm to patients. And 2, highlight the relevant sections of USP 797, Pharmacy Compounding Sterile Preparations. Consistent with the request from the committee, staff will also be exploring the ability to create an educational video. Board staff will continue to engage with other healing arts boards on the materials and will continue to offer co-branding of the document with programs that are interested. Provided in attachment 2 is the updated draft information sheet intended to provide guidance to compounding facilities that are not regulated by the boards. At this time, I'm going to open it up for member comments. And I can't see you all, so please speak up. Okay, no comments. So
Nicole?
A comment.
Nicole, thank you. Yeah, I really appreciate the good work that the committee has done because education is key. I do have a couple of comments. One is on the first paragraph, it talks about offer walk-in IV hydration services. And the policy statement talks about those also that occur in the home, at parties, in hotels. And so I'm concerned with the word walk-in. And while I think that really does apply to the members of the public to understand what a walk-in, but I think maybe including something about in-home or or just even taking out the walk-in.
Yeah.
Either way. Secondly, I really like the consistent process that we have also in the policy statement that shows people how to do a license search. I think that it would be nice to include something about the license searches for the location and for the personnel in that location. Because it could be that there's a nurse in that location. And so it doesn't necessarily need to be a pharmacy person. So something about personnel, I think, would be helpful. And then lastly, the big one I left to the end is the title. Compounders, it's not really understood by the public. I think we need, especially for an educational material, it needs to be something catchy, understood. And if you noticed, actually probably didn't notice it before when you were looking at this, we did change the policy statement also to talk about risk to patients and putting risk in there and some really different words. Because if I were a community member and I saw education for compounders, I wouldn't go any further because I don't compound. I don't know what that means. So I just encourage a better, flashier title.
Thank you. Any other comments?
Other than to agree with Maria. That's it. Yeah.
All right, perfect. We can move to public comment in Sacramento. I don't need to rely on you all to tell me if anyone's coming.
There does not appear to be any public comment in Sacramento.
Thank you, Anne. We can open for public comment via WebEx.
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue?
Yes, thank you. All right, so that concludes the report for the Communication and Public Education Committee. And President O, I'm actually also providing the report for the Legislation and Regulations Committee. Do you want me to just keep going or do you want me to stop?
Oh, go ahead. Vice Chair
Okay.
Thibault. We're ready to move on to next agenda item 15, Legislation and Regulation Committee. Back to you.
Thank you. Member, there's a number of measures included in the agenda considered during the committee's July 18th meeting. Having already passed several legislative deadlines, the legislature is currently on summer recess and reconvenes August 5th. The meeting materials will note the board's position as applicable. There are a few new measures as well. As included in the meeting's materials, the committee is recommending changes to the board's position in a few areas. The Legislation and Regulation Committee report will only include discussion and consideration of AB 3063 and SB 1089. Please refer to the meeting materials for the other items included on the agenda. So the first one we're going to discuss today is Assembly Bill 3063. Members, Assembly Bill 3063 is similar to AB 782 from last year. As a reminder, the board initially established an oppose unless amended position in the hopes the board could work with the author's office to discuss implementation challenges that some pharmacies may have indicated they would experience as a means to facilitate the policy goal of the measure without creating a conflict with state and federal law and national standards. Regrettably, that did not occur. The primary difference between the two measures is that AB 3063 includes a sunset date, meaning that conflict would only exist until January 1st, 2030. As previously discussed, inclusion of the sunset date does not address the board's concerns. Following our discussion, the board ratified the oppose unless amended position established by President O as part of the April 2024 board meeting. Since that time, staff conveyed amendments to the author's office for consideration. Specifically, the amendments would have focused on actions to facilitate implementation of the USB requirements. Regrettably, those amendments were not accepted. As such, I believe a change to an oppose position is appropriate. As was noted during the committee meeting, that there is published research that demonstrates the impacts of flavoring agents on medications. As an example, in published research entitled Interactions and Incompatibilities of Pharmaceutical Excipients with Pharmaceutical Ingredients, a Comprehensive Review, most excipients have no direct pharmacological action, but they can impart useful properties to the formulation. However, they can also give rise to inadvertent and/or unintended effects, such as increased degradation of the drug. Physical and chemical interactions between drugs and excipients can affect the chemical nature, the stability and bioavailability of drug products, and consequently their therapeutic efficacy and safety. Such a conclusion reinforces the importance of compliance with the national standards, most notably provisions for establishing beyond use dates. After considering the measure, the committee is offering a recommendation to change the board's position to oppose. With the committee's recommendation serving as the motion, are there any questions or comments from board members?
Thank you, Nicole. This is Maria. I just wanted to reiterate that the board is not opposed to using a flavoring, but we do have a pathway for adding flavoring that's being proposed in our compounding language. Flavoring is an important option to provide patients for palatability of medications, but the USP has spoken, and that's the national standard on flavoring, and we're following suit.
Thank you, Maria. Any other board member comments? And is it, let me ask for the legal opinion, is it appropriate to remind here that the discussion is focused on changing from an oppose unless amended to oppose position?
Yes, that's fine to remind commenters.
Thank you. Okay, with that, can we open for public comment in Sacramento?
I don't think we have anyone, Nicole.
Thank you. Can we move to open for comment via WebEx?
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand. We will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
Yes, please. Thank you, David. With that, I'm going to turn it back over to President O for the vote.
Thank you, Vice Chair Tebow. Voting on the committee recommendation to establish an opposed position on AB 3063. Jeff, how do you vote?
Yes, I oppose.
Yes.
Yes.
Yep. See all these double negatives, I feel like. KK?
Again, are we?
We're voting to affirm that we're establishing an opposed position on Bill AB 3063.
Yes.
Okay. Thank you, KK. Jay?
Yes.
Thank you, Satinder.
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. Back to you. One more
Thank you.
item.
Yes. The second item for Ledger Edge Committee is Senate Bill 1089, addressing food injustice, notice of grocery and pharmacy closures. Members, the committee and board did not previously discuss this measure as it was not identified in advance of notice requirements. As indicated in the meeting materials, as related to the board's regulated public, the measure would require a pharmacy to provide advance notice of closures to employees and specified agencies. Through his delegated authority, President O established a support if amended position, requesting the board be included in the list of agencies that receive notification of closure. I note that the amendment sought was consistent with the board's policy in this area, where the board is seeking amendment to regulations to require such notification. I am pleased to report that the author accepted the board's amendment, and the board is now included as one of the agencies to receive such reports under specified conditions. Given this change, the committee is recommending that the board update its position to support. Members, do you have any questions or comments?
Doesn't seem to be there, Nicole.
Thank you. Then we can open it up for public comment in Sacramento.
There doesn't seem to be any public comment here.
Thank you. Then we can open it up for public comment via WebEx.
We are once again open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. And our first request looks like it's coming from Stephen Gray. Hold on just a moment. We're sending you a request to unmute your microphone.
Thank you. I think it's very unfortunate that the committee and the full board did not have a opportunity to fully discuss the implications of this bill. I think in general, I think that the idea was well intended, but there are, if you read the bill, there are advance notices that are required depending upon the type, size of pharmacy that you have to give the employees if you plan to close a pharmacy. The board's position before was giving notice to patients about closing of a pharmacy, where they could get their prescriptions, et cetera. I do not remember the board or the committees discussing advance notices to employees. But one of the unintended consequences that happens when you tell employees 30 or 60 days in advance that the pharmacy is going to close and go out of business is they immediately start looking for jobs elsewhere. That leaves them for that 30 to 60 days or sometimes longer, understaffed and unable to provide the services to the patients they've been serving. And obviously, if someone applies for a job in that time period, I think the implication is you have to tell them that also. So finding additional help is a problem. I think that should have been discussed before the Board of Pharmacy takes a position. By that, I mean it should be discussed the impact on patients and the public of advance closure notices. Otherwise, the bill is primarily a benefit to employees, giving them a chance to find other work and leaving the pharmacy in very serious conditions about the ability to serve their patients for the remaining period. Thank you very much.
Thank you for the comment.
That appears to be our only request for public comment at the moment.
Great, thank you. We can close it. Taking it back to the members, do you have any additional comments?
Doesn't seem to be ready.
I would like to take back what I said. We do have additional requests for public comment.
Is it okay if I reopen it?
Sure.
Is that allowed? Okay. I don't want to cut anyone off.
Absolutely.
Okay.
All right. Jassy Jerwal, we're going to send you a request to unmute your microphone.
Hi, this is Jassy Graywell again with UFCW. Apologies, there must be some delay in the Q&A function because I keep saying make comment and it I think comes in a little delayed. But UFCW is one of the sponsors of SB 1089, and I wanted to provide a bit more context on this bill and appreciate the board's engagement and the committee's recommendation of a support position. Back in October, and I'm just citing a more recent example of a pharmacy closure situation that we have been experiencing and our members have been experiencing. But back in October, Rite Aid declared bankruptcy, and the notices that have been going out to consumers and to patients is very scattered. Initially, when the bankruptcy was announced and store closures were happening, I mean, to date, there are over 100 at least union stores. We're not counting the non-union stores that have closed in California alone. And there used to be 2-week notice that would be sent out to the workers and posted on the wall of the store for patients. That notice quickly turned a couple months into same-day notice, 2-day notice. There are situations where we're still getting 2-week notice, but it is all across the board. And what is that has caused is actually a lot of patient harm. In the situation of Rite Aid, where some prescriptions are being transferred to other Rite Aid facilities, some of them are actually being sold off to Walgreens, but there's no notice being sent to the patients of where their prescriptions are going, or who to contact or how to get prescriptions transferred to a pharmacy of their choosing, knowing that oftentimes another Rite Aid or another pharmacy might be out of reach for certain patients to be able to go to. And we have heard numerous examples of patients showing up to a closed pharmacy thinking they were going to pick up their refill, and then now frantically calling around to all the other pharmacies. Some of them are other union stores, and I'm being really frustrated by the fact that they don't know where their prescriptions are going. Our members do try to help their best and calling the doctor, trying to get it transferred to that pharmacy. But it is a very dysfunctional process right now. And so I just wanted to highlight that there is actually consumer harm being happened, absent any action being taken. And so what this bill does is require some notice and an advance notice to the patient to let them know your pharmacy is going to close. Take the proper means to be able to transfer the prescription of your choosing. We have examples where patients are showing up to out-of-network pharmacies now and having to pay full price for prescriptions. And so that is also a huge concern as well. And I just wanted to address the staffing issue. In our situation that we have observed, we have not seen staff leave pharmacies and their jobs. They do stay on until the very end, sometimes even after closure, to help the store wrap up their services when it's not open to the public. And so some of the examples around like people are just leaving and able to up and find jobs elsewhere is just not true. We have had a very difficult time getting pharmacy members transferred to other stores and other locations and companies. And so there is a workforce that's willing to work. It is not as easy as just saying, tomorrow I'm going to be working at another pharmacy. So we just have not observed that example. Thank you.
Thank you for the comment.
All right. And I believe that was our last request for public comment.
Okay, thank you so much. Members, are there any additional comments? If there are none, I'm going to turn it over to President O for the vote.
Thank you, Vice Chair Tebow. Jeff, how do you vote?
Yes.
Thank you, KK.
Yes.
Thank you, Jay.
Yes.
Thank you, Satinder.
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes, the motion passes.
Thank you. And that concludes the Legislation and Regulation Committee report. I turn the meeting back to you, President O.
Thank you, Vice Chair Tebow. Thanks for all the work the committee do. We're ready to move on to next agenda item 16, discussion of proposed issues to raise as part of Sunset Report, as included in the meeting materials in preparation for completion of the board's legislative report. Today, we have the opportunity to identify issues for potential inclusion in the board's report. As a quick reminder, the board has already identified a number of issues. Today, we will focus on additional issues that may be appropriate to consider. I do not believe it is appropriate to make decisions on these items today, but rather request that staff perform research on the concepts and offer recommendations for our consideration at a future meeting. As included in the meeting materials, Kaiser is offering changes in 3 areas. I agree that the items recommended by Kaiser should be researched by staff, with the recommendation being offered at a future meeting. I do note that I share some of the same concerns raised by Kaiser related to pharmacy technicians and agree some cleanup language would be appropriate. Members, any thoughts?
I'd like to share my agreement with the recommendation number 2 from Kaiser. That's something that we have discussed, I believe, at a board meeting, if not at a committee meeting. I can't remember exactly which meeting. And that cleanup language would be ideal. Most recently, we had a similar discussion on the same section of BPC code. So it'd be another issue that I'd like to be included in that discussion. And that has to do with pharmacy technicians receiving, I believe it's called telephone orders. I don't have the words in front of me. And our attorney's interpretation of receiving means receive, not initiate.
I think prescription transfers.
Transfers.
Yeah.
Thank you. Prescription transfers. And so it seems like the potentially the intent did not make it into the regulation. And that was one of the comments that was made at the Enforcement and Compounding Committee. We did have public comment during that time that said that that was purposeful because I guess there was some testimony at the time that people did not feel comfortable with technicians initiating the transfer of prescriptions, that they wanted the pharmacist to be involved to assure there was no diversion of transferring prescriptions. So I think there's more discussion that could be had on that to see if that was an error or if that was an intent.
Thank you, Maria. Great comment. Any other comments on the Kaiser? Okay.
I
Are we
agree
just
with
talking
that.
about Kaiser or the whole
Just
thing?
Kaiser for now, and then we'll
okay,
open up
okay.
for anything else, free for all. Ready
Thank
to
you.
just put everything out there. Yeah,
I agree.
good to go. Okay. All right. Next is the request from the California Pharmacy Council Requesting the board consider a change in the title of advanced practice pharmacist to advanced pharmacist practitioner. I personally am comfortable. Seems like a very minor change that hopefully could propel the usage of advanced pharmacist practitioners and their recognition and what they're able to do. So, members, any comments?
Yeah, I agree. I think it's a step in the right direction, and reasoning provided is, I agree with it.
Great.
This
Hey.
is Nicole. This is the one I wanted to comment on as well. We're actually working on some potential changes to some federal language on the 340B drug discount program. And we were actually struggling with this. What word do we use in that to make sure pharmacists can be included as a prescriber? And this change would actually help. It would make it more consistent with some federal language and the coverage of medication. So I would highly advocate for this.
Sounds good. Thank you. All right, we're ready to move on to the next. Also included in the meeting materials are a number of additional items that have been identified that may warrant research and a recommendation for possible inclusion in the board's report. I understand that some of these issues may be quite an undertaking, and we may not be able to fully vet and offer recommendations. As you all know, the timeline is very tight. We're expected to finalize the report by the end of this year and ready for submission by next year. So, and the hearing will convene sometime next year, early 2025. Time just flies by. So all these items I'm very comfortable to include however we can. And here is the opportunity for members to bring up anything that they would like us to include as part of our research and potential consideration in the future.
So President O,
Yes, KK?
line number 5 in the role of telehealth and other platforms in directing patient to specific pharmacies. That's what we're talking here, right? So
Anything, yeah. You can add on.
what I'm not specific to this, but I was hoping that we can adapt a specific language that would say consumer in this state is free to access any pharmacy, because this is a true statement for any other settings where pharmacist, for example, a assisted living facility, a patient has a choice to go with a contracted pharmacy that delivers, or any other any other pharmacy where they want to go themselves. I think we can adapt a language which is like a statement that we can provide and say, this setting, this setting, this setting, use this statement, and that is basically a consumer facing statement that tells the consumer that in this setting or that, I have free will to pick my pharmacy. And I think it will be, if it's a uniformly worded one approved statement, it'll be unambiguous for the consumer in all the settings. So that's what I suggest.
Thank you. Anything else, KK, you want us to contemplate for sunset item? Anything, anyone else?
Or for now.
Maria?
I'd like to just share a little bit about number 1 and the importance of that. And so I'm really pleased to see it on here. As you know, yesterday we had a regulatory hearing, or not hearing, regulatory discussion, and we've had a little bit today too, is all of our self-assessment tools, except for the surgical clinic one, are regulation, which require a regulatory hearing and multiple meetings and long time to get through. And in fact, a couple of times, at least in my tenure here, we are making changes to changes to changes because it's taken years to get the regulation through and there are additional changes. So having that a requirement in statute is wonderful. Thank you.
Thank you, Maria. Anything else to bring today for sunset items for us?
This is
Go ahead,
Nicole.
Nicole. Yeah.
Sorry, it's so awkward to jump in. There
Just
are
jump in. We're almost done for the day anyway, but
these are all important. I think they should all be there, but I really wanted to call out number 2 as it's related to a lot of the stuff we've been talking about recently. Number 4, because if people can't access pharmacies, they're not getting adequate health care. And particularly number 8, I take in my interpretation, number 8 includes pharmacy benefits managers, PBMs, and we know there are some bills working their way through that may impact this, but I think with all these pharmacy closures, and I can't remember which meeting it was in, but we had a meeting recently and it showed that the number of pharmacies in our states is going down over the last 4 years overall by a fairly significant number. And I have to wonder how much of that is these activities by payers, and that is ultimately creating an access issue for patients. And if patients can't access to pharmacy services, then there's a big part of their care missing.
Thank you for the comment, Nicole. That's absolutely true. Any new items to add? I know this is very long list. Don't kill me, Anne, please. I'm not trying to add more to the list, but just wanted to make sure. I mean, we have a lot of opportunity to talk about sunset, so it's not just today. All right. Well, that seems to have concluded almost. We're ready for public comment. If public comment, any related to agenda item 16 in person, there's no public comment. We're ready for WebEx. I'm hoping our WebEx could provide us some creative things that we can look at in our sunset as well. So ready for public comment.
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand. And we will call on people in the order we have requests. And our first request comes from Jesse Graywall. Hold on just a moment. We're sending you a request to unmute your microphone.
Hi, this is Jassy Graywell with UFCW again. Really appreciate this list of items to be considered for sunset review. I did just want to flag a couple that I think are really important for this board to dive deeper into. Number 3, related to incorporating AI into the pharmacy practice. We are starting to see AI and AI tools being expanded into numerous fields, including the healthcare profession. And so it would be really, I think, important that we look at this issue area and figure out how can we regulate the use of AI so that it's safe for patients and for the workers who are incorporating it into their clinical decision making. Ultimately, at the end of the day, AI cannot replace the clinical decisions of a pharmacist. And so how do we work with AI instead of having AI take over the role of the pharmacist? And then I also wanted to flag number 6, delivery services related to prescriptions have been expanding exponentially. And I think something that this board should consider is what are the requirements to ensure the safe delivery of medication? Some medication needs to be refrigerated and kept at certain temperatures. So how do we ensure, and then also properly delivered to the right patient? So how do we ensure that that's actually happening? To my knowledge, there is no current regulation or requirement in California around the safe delivery of medication. I believe there are some national guidelines, but I think it would really be important for this board to look at that because we do already know that there are delivery drivers from some of the pharmacies that are doing on very hot the Coachella Valley and the Central Valley, and they're not even putting the medication in a cooler. They're just relying on their air conditioning in their car. So we want to make sure that if there are delivery services around medication, that it's actually getting properly delivered. And then just want to flag that when we look at third-party platforms, so your Ubers, your Instacarts, your DoorDashes, what requirements and liability do they have when they are delivering very sensitive medication, controlled substances, et cetera, because those are not employees of those platforms. And so that liability is a very different structure. So we just wanted to flag those and stress the importance of number 3 and then the last item. Thank you.
Thank you for the comments, Jazzy.
Next, we're going to hear from John Gray. Hold on just a moment. We're sending you a request to unmute your microphone.
Hi, good afternoon. This is John Gray, registered pharmacist with Kaiser Permanente. Mostly just want to thank the board for the decision to earnestly evaluate the recommendations that we made in our December 2023 letter. You know, I heard you all mention kind of recommendation 1 and recommendation 2. I'll just flag that for recommendation 3, the problem we're really trying to solve for is just the vast amounts of quantities of paper that pharmacies currently feel they're required to maintain for the required record retention period. Largely, that's particularly a problem in the hospital and health system setting, where we may be receiving multiple orders a day from wholesalers and directly from manufacturers, and so we end up with multiple invoices a day from multiple different parties. And so the apparent requirement to maintain those in the form in which they were made becomes honestly a space issue for many of our pharmacies. We recognize that the offsite waiver is an option as well, but that there are cost considerations associated with, again, housing the paper somewhere else. So we really appreciate the board and board staff taking a look at that. Also, open to other creative solutions that board staff might come up with. Perhaps board staff might consider whether the offsite storage waiver provision under 4105E could be applied to solely electronic storage of documents that were initially made on paper. Maybe that wouldn't even require a statutory change. So again, just mainly want to thank you all for taking a look at our recommendations, and I look forward to further discussion. Thanks very much.
Thank you for the comments, Dr. Gray.
And that appears to be our last request for public comment.
Thank you, David. Okay, we are done for agenda item 16. Next is agenda item 17, which we are going to discuss, and the meeting materials provide information. So we're moving on to the next agenda item 18, which is Executive Officer Report, which we will also skip for the day. So we are ready for a closed session again. So I would like to thank members of the public for your participation today. As indicated on the agenda, the board will now reconvene in closed session to discuss the items set forth on the agenda. Adjournment will immediately follow closed session, and there will be no other items of business discussed.